Sitting in the living room of her St. Joseph home, Sarah Clark remembered an unexpected but prophetic piece of advice she received not long after the birth of her daughter, Kennedy.
The doctor at Children's Mercy said, the biggest advice I can give you is to start lifting weights. And I was like, I didn't understand that at the time. Like, why lift weights?
While only a small bit of guidance in the moment, it's gone a long way now for Clark as she helps her 8-year-old daughter, Kennedy, every day with many tasks like moving up the stairs or getting into the car. Kennedy was born with an extremely rare genetic condition called STX-BP1, a neurodevelopmental disorder that requires near constant supervision and assistance. She's also been diagnosed with autism. The odds of a child being born with STX-BP1 are 1 in 30,000. First discovered in 2008, STX-BP1 causes mild to profound intellectual disability, along with a wide range of other symptoms and disorders like epilepsy, spasms, developmental delays, and low muscle tone.
She came out of me seizing, basically. So I knew there was a battle ahead of me. I didn't know, how I would take care of her or what I would do, but we learned together. Every day we learn together.
Studies are constantly providing new information into the condition that still has limited research and many unknowns in the medical field. Along with trying to learn about the disorder, it's made parenting and finding consistent help for Kennedy all the more challenging. Clark was forced to pull Kennedy from daycare due to persistent seizures, leaving both of her jobs to become a near full-time caretaker.
But I wish that somebody would open up a daycare or a facility for children like Kennedy. It's just children like Kennedy need one-on-one care.
Without the support of her husband, Roger, the situation would be all the more challenging. Now, the number of children being diagnosed with a developmental disability is rising at a notable rate across the United States. Nearly 1 out of 10 kids and adolescents aged 3 to 17 were diagnosed with some form of a developmental disability in 2021. That marks a sharp increase from the 7% likelihood seen just 2 years earlier. And despite notable strides over the last 2 decades strengthening programs, services, and awareness for infants and children with developmental disabilities, Clark and her daughter are an example of the struggles many families still face, navigating the system and connecting with specific healthcare experts and other services to accommodate severe developmental disabilities. Typical of parents who have a child with a developmental disability, Kennedy was referred and began her journey with early intervention services through Missouri's First Steps program for infants aged 0 to 3. Studies have shown that children who receive early intervention services have better outcomes in communication, socialization, and behavior than those who do not receive intervention.
Children learn the most during those early years, so we really want to set them up for success by providing that early intervention so that we can prepare them for kindergarten and life.
According to the National Library of Medicine, most children with XTX-BP1 related disorders are able to independently walk by the age of 5. Clark credits her First Steps coordinator with helping her daughter sit up by 7 months and walk by 2.5 years old. As vital as those steps were for her development, she wants to see First Steps services extend beyond 3 years more often, especially for children with disorders like Kennedy's.
If I had my way and I was able to, I feel that she needs, an hour or 2 hours of these every week, and she just doesn't get it.
Challenges within the First Steps program are stretching resources and providers thin in certain areas across the region and the state. A report from the Infant and Toddler Coordinators Association revealed that Missouri and nearly 50 other states had reported shortages of qualified providers for early intervention services. Jennifer Welsh spent 5 years working as a behavior consultant and in-home therapist with First Steps and has more than a decade of experience as a behavior specialist. Everything changed after modifications to the state's Medicaid billing model forced Missouri to adopt new certification requirements last year, forcing many longtime providers, including Welsh, to leave the system.
Of maybe the 14, 15 behavior specialists, only 2 of those people were board certified behavior analysts. So it's really likely that you're losing 12 providers in Kansas City area. And if you go to Northwest, then they've lost, 80% of their providers.
Clark saw her last patient in October of 2023 and now works in adult services with Square Pegs for Families in Lee Summit. She's not surprised that parents, especially first-time parents of special needs children, can easily be overwhelmed with balancing everyday life and taking care of their child's specific needs, which creates challenges connecting with needed services that can sometimes fall through the cracks.
Probably because I'm a parent of children with special needs and knew how difficult it is to navigate that system and get the services you want. I would go in and say, okay, now you need to go to your your service coordinator and ask for this.
The shortage of providers comes as more and more children are joining the program each and every year. Data from the Missouri Department of Elementary and Secondary Education shows that close to 10,000 children were involved with the program in 2023, an increase of more than 2,000 children compared to 2018. In Buchanan County, nearly 150 children were served in 2023. Governor Mike Parson and the Missouri legislature have responded to the situation by boosting program funding by $21 million from $53 to $73 million in 2023. Missouri has also boosted support by creating the Office of Childhood in 2022 to help administer state and federal funds to support services that assist children with developmental disabilities. The office's primary goal is to help unify childhood programs that were previously fragmented across state agencies. St. Joseph isn't immune to the same staffing and service gaps that are impacting the region, but numerous organizations are consistently looking for ways to strengthen programs, identify needs, and bridge and partner services with other organizations to help reach as many families and children as possible. Bobby Kronk, United Way Director of Children's Initiatives, is front and center doing just that with the help of their Success by Six program, one of the nonprofit's driving initiatives. Spreading awareness of what's available in and around St. Joseph can be just as vital as the services themselves to ensure that parents are taking advantage of needed services for their child's development.
How can we maximize, which is, what is a really pretty limited pot of resources? How can we maximize those limited resources to make the biggest difference for the families?
If an organization isn't able to provide the necessary services or resources to help a child or family, they'll connect them with other resources like Community Action Partnership, United Cerebral Palsy, or the St. Joseph School District's Parents as Teachers program. United Cerebral Palsy contracts with local school districts to provide key early intervention services and offers integrated preschool programs that connect children with and without disabilities in the classroom.
So we not only provide therapy here at UCP, but we also go into the homes and serve children birth through age 3. Our providers are pretty full, so we have seen an increase in need. Luckily, we're able to meet the needs of the referrals that we get.
Another key pillar in St. Joseph's network of services, the St. Joseph School District has had to be proactive over the last 2 years in looking for creative opportunities to bolster services and navigate around the same statewide challenges with staffing for speech-language pathologists.
It's important that we're all working together because we have so many different resources in our community, and unfortunately we have limited resources sometimes as far as staffing and spots and things like that. So when we work together, we want to do as much early intervention as possible, so we want parents to know kind of where their child is developmentally.
Once a year, Clark and Kennedy make a 9-hour drive on U.S. Highway 36 to the Children's Neuroscience Institute in Aurora, Colorado. There, she's able to get access to advanced medical services and work with doctors who have seen the STXBP1 gene mutation in many children. Prior to that, she was regularly making trips to Kansas City to see all the different therapies and clinics critical to Kennedy's development. Even with a strong number of pediatricians and medical services in St. Joseph, Kennedy's condition requires an advanced level that many places aren't able to provide.
She doesn't see specialists that often. I feel like if there were, places closer, therapies closer, we would be able to attend them and she would go to them more often, but they're not in St. Joseph.
In Clark's eyes, St. Joseph is fortunate to have a place like the Helen Davis State School for the Severely Disabled. The school is able to provide Kennedy with some therapy services in certain areas. An expansion of before and after services at Helen Davis and other facilities for kids like Kennedy would help her family and fill a much-needed void in the community. And despite the numerous challenges endured throughout Kennedy's life, Clark has always stayed strong and positive. For the sake of her family, she believes her daughter will continue to make strides in her development. It's been nearly 2.5 years since Kennedy had her last seizure. Clark is holding out hope that she'll hear her daughter say the word mom one day. Cameron Montemare, News Press Now.